Its mission promotes dignity, independence, and advocacy for all older adults and people with disabilities and their family caregivers. Its service to our region celebrates a 50th anniversary this year. What began in 1974 as the Northeast Area 3 Council on Aging has grown to be known as Aging and In-Home Services of Northeast Indiana. And we'll learn more about the work of this multifaceted regional agency on this week's Primetime. And good evening, I'm Bruce Haines. With us this evening from Aging and In-Home Services of Northeast Indiana are Lori Bones, Vice President of Population Health, and Abbey Graves, Aging and Disability Resource Center Director. And we invite you to join our conversation anytime. Just call in your questions or comments by using the number you see on the screen. As we widen out and welcome our guests, there's Lori, there's Abby. Thank you both for being here. We really appreciate it.
Thank you for having us.
Absolutely, thank you.
Since the beginning is always a good place to start, let's start back in, say, 1974. Give me, this is a horrible thing to ask, a 90-second version of 50 years. What is Aging and In-Home Services? Tell us about the work you do and who you serve.
Aging and In-Home Services is our local area agency on aging. It came down from the Older Americans Act. They divided up. Every state has different areas on aging that they're divided up into, and so we cover the 9 counties in northeastern Indiana. And we provide a whole variety of services. It started off with just home delivered meals, and then it developed over time we have a family caregiver center, we have our resource center where individuals call in for services, we have case management that's ongoing. So we sort of encompass as many different services as we can.
And we can share on the screen that breakout of where those 9 counties are. So as you're watching from home, you can see whether you are a part of it all. And we talk about the state being divided up into different sections, and this is obviously our own, which is quite appropriate and probably more than enough. 9 counties calling all the time. Who all is on the phone or drops by when you're connecting? We have something about the clients that you serve, Abby.
Yeah, absolutely. So as being part of the Aging and Disability Resource Center, as we call it, ADRC, we handle about 6,000 contacts a month. So that's caregivers calling in looking for services for their loved ones. It's individuals calling in saying it's time, I need help. It can be individuals calling in needing assistance with applying for benefits, so Medicaid or Medicare assistance programs. We really do try to assist as many people as possible.
And we have come a long way since the tried and true Meals on Wheels kind of program. I see now we broaden out to nutrition and being able to return to as much independence as possible after prolonged care. And I think about mile markers along the way. We will get to more of these in a moment, but a family caregiver program, an aging disability resource center, we will talk about that. PACE, a partnership with Parkview, and all of this adding, here comes the question, it seems like it's all development happening concurrently with the rise of older Americans who need care, have questions, and are looking for assistance. You get that sense?
Oh, definitely. I'd say we consider ourselves to be the premier resource for older adults, individuals with disabilities in the community, as well as the family caregiver. The big emphasis is to age at home, age in place where you can be comfortable and safe. And so we are continuing to diversify and add additional services that we can to help support individuals to age in place at home.
And in fact, it's right at the top of the core programming that you supervise on a regular basis. Let's walk through that notion of what ADRC is.
Yeah, so we're the Aging and Disability Resource Center, so we like to call ourselves the No Wrong Door. You can come to us and ask us any question. We're going to try to find the answer if we don't have it off the top of our heads. So we're going to do research, we're going to do additional steps, we're going to follow up, we're going to make sure that the individuals are able to get access to the services that they need and that they qualify for.
And in addition, that may be the best way, I assume, or the most expeditious way to try to call a central operator, if you will, and please connect me to whatever it may be.
Yeah, so I mean, individuals are welcome to call us. They can walk into our agency during our business hours. A lot of community connections that we have will actually submit referrals directly to us so that our options counselors can call them back to screen them and to kind of help connect them with all of the options and possibilities for those individuals.
I saw the statistics on the side here, 3,000 calls a month?
You know, and I would say that's kind of conservative. I would say we're probably closer to 4 to 5.
No kidding.
Absolutely.
Wow. And among those programs, you saw the core services, and you see the demand for it. We have a chart to show you just the difference between the last couple of fiscal years of the number of folks who are contacting aging and in-home services looking for activity or delivery to help them. It seems like it's a tale of 2 different years, but they are literally consecutive. How do you
I would say
come to grips with that?
Right, our calls are growing exponentially. I definitely think the pandemic had an impact on the health and well-being of individuals at home, especially our older adults and those with disabilities. They were kind of cut off, lost some of that social connection, which is very important for your health and well-being. And so we have definitely seen a significant increase, as Abby can attest to, with her department growing, all these calls coming in. We get a lot of referrals through our website as well for individuals reaching out. And then for us just to connect them with whatever they're reaching out for. It might be something as simple as providing a phone number, or it might be having them screened for a program that we can offer.
And I assume that past performance in this case is an indication of future return because of the number of Americans 65 and older that's expected to increase. And as the baby boomer wave comes onto the shore, I believe it was a national agency that had posted information from 58 million in 2022 to 82 million by 2050. That's going to take that monthly call count up a little bit.
Absolutely, yeah.
We'll have to onboard some more staff to field all those phone calls.
My goodness. Yeah, it's something that I'm sure must be addressed on an ongoing basis, the breadth of the needs that are being asked about now. And also everything from Medicaid waiver, Meals on Wheels, we spoke of that. You're the contact for the state health insurance program?
Yes. So in the ADRC, all of our options counselors have been gone through an extensive 3-day training with the State Department of Insurance in order to be able to assist individuals when selecting their Medicare plans and like going over Part D plans, Part A, B, and C plans as well. So we can really look at each individual and try to help assist them in a non-biased fashion on what health insurance plan would be the best for them.
I think too, in regard to this, you have individuals, and you said at the top of the program about those who wish to have care such that they can still be in their own home. There is a concern of late about older adults and mental health. And those who, whether they're looking, they have other family members who are checking in to see what kind of condition their family member's condition is in, or it's about medical delivery or meal delivery. The state of caregiving in the country is significant. Tell me about the caregiving center that has now become a part of aging and in-home services.
Yeah, so our Family Caregiver Center is very essential to our programming. As you mentioned, caregivers are essential to individuals remaining at home and getting the care that they need. At our Family Caregiver Center, we have a few different programs where we can provide some services for individuals. We can provide them with some in-home respite. Maybe the individual that needs care can go to an adult day service for respite. We can get some additional supplemental services in there for them. We have support groups that the caregivers can attend. We have something at the library where the individuals with dementia and their caregivers can attend as well and go in and just kind of spend some time and do some crafts and things together. We have some phone services. So if a caregiver just needs some support through the phone, which is often very essential, then they can call in and get some phone services that way as well.
It seems that we will all follow, or fall rather, on this continuum. I think it was Rosalind Carter's quote that maybe many are familiar with, and you've heard it many times: 4 kinds of people in the world: those who have been caregivers, who are currently caregivers, who will be caregivers, and who need caregivers. And I assume heads nod all the time for that.
Yes.
Absolutely, yeah.
I mean, that is a lot of our callers that are calling in are the caregivers looking for assistance that we can provide.
And one of the upsides of having this conversation now, which should work any time of year, is the month of May has its focus on Older Americans Month.
Yes.
Maybe share a little background on that. And this year's theme, it seems, really ties into this notion of no older American should be an island.
Right.
Sure. Yes, it's the theme is power of connection. So really talking about, not letting these individuals stay in their homes by themselves and really helping them get connected, helping them get out into the community, but helping them age where they want to be. If they want to remain in home with supports and services, connecting them in a way to allow them to do so, and also provide support for their loved ones, their caregivers. So it's really an all-inclusive scenario that we want to encourage.
And in that work, do you find AIHS connecting with other nonprofits too, or church groups, or others that you have a social dimension to it, or what have you?
Yes, I think on many different levels we try to connect with others in the community as much as we can. Just as I know other nonprofits and other organizations in the community reach out to us to however we can all collaborate to keep individuals safe at home. I can say you had mentioned mental health as a concern for our older adults. We are working on a grant right now, so we have some services that we have in place for our older adults with mental health concerns. And with that, we are working a lot with our community mental health centers. So we are connecting with those centers and getting our individuals that need some assistance connected with those centers. And then just on the resourcing side, we connect with a lot of other organizations like NeighborLink. If someone needs, some kind of a home project done, anything in the community that we think could benefit the callers that are calling in, we'll try to connect with them.
Yeah, I understand there is an offshoot of this called frequent mental distress, which gets involved with hampering a person's ability to eat, maintain a household, work, sustain relationships. This is more than just having someone to chat with. So the idea, as you mentioned, of powered by connection as the theme for the month, this is an overarching concern.
And we definitely see that in multiple spots within our agency. We have a congregate meal program as well that individuals actually can attend a meal together to form that community, to form that connection, to break that isolation. It really allows them that togetherness, as well as our Pay Center, powering that connection, allowing individuals to commingle, develop relationships, all in a safe environment.
A number of other programs that are offered at Aging and In-Home Services, and we'll talk of those, but if you would like to talk about a particular topic on your mind, you can call our number and join our program as we have guests this evening from Aging and In-Home Services. Population health. This is even in your title, and
Yes.
whether you would like to tell us about the work you do and how that connects to core programming with the agency.
Yes, definitely. So our population health department consists of several different programs underneath the umbrella of population health. And essentially what we're doing is we are working with a lot of referrals from different health insurance plans. They refer members to us who might have some sort of need based off their social determinants of health. So it might be a need for housing, it might be a need for food, might be a resource to help them pay for their utilities. All of these things are essential to your own physical health and well-being. And so we get referrals, we do assessments with members, we provide a lot of resourcing for them to help connect them with anything that they might need to help them stay at home safely as well. It's much more of a short-term service, just like some of our callers into the ADRC. But we can, hopefully keep them home safely, keep them out of the hospital by connecting them with all those different resources in their communities to meet their basic needs.
Wow. We mentioned PACE, and when we talk in acronyms, it's always good to break that down. Abby, tell me a little bit about this partnership with Parkview.
Yeah, so it's the programs of all-inclusive care for the elderly. It's a great program. Individuals are able to get significant amount of their medical attention in one spot, so they're not having to go to multiple offices to get their medical attention. And if they do have to leave the PACE Center for anything, the PACE Center does provide transportation for those programs. Individuals do remain in the home, and they have access to PACE transportation to and from the center in order to ensure that they can safely get there. The PACE Center, they have medical staff. They can assist with showering, warm meals, bathing. There's a variety of different things that that PACE program does provide, and it is, again, partnered with Parkview for that medical component.
And so as that program has multiple facets, and Aging and Home Services, as you're hearing, does as well, you sometimes think, how does all this tie together into the daily, weekly life of a nonprofit? We have a video that we'll share with you, indeed, just how all those different aspects of life for older American care is conquered in Northeast Indiana through AIHS. We're going to look at that life from just within the last year or so. Take a look. From the past year to looking ahead to the coming months of 2024, we want to spend a little bit of time on something you may well have seen word on, or should have. It's called Indiana Pathways for Aging. It is a new way for servicing Medicaid in Indiana. It's coming in July. July is 10 minutes from now. So,
Correct.
Lori, Abby, walk me through what is all this?
So Pathways for Aging is a very large transition for the state of Indiana. It is the shift from sort of a fee-for-service Medicaid, so paying for services as you receive them, to a managed long-term services and supports program, which essentially means that 3 different insurance companies in the state are going to be overseeing and managing the health services, the in-home services for these members that are 60 and above. Those 3 health insurance companies are Anthem, Humana, and United Healthcare. That's who the state has partnered with to get those services going. And so all of the individuals 60 and above on Medicaid should have received some notices in the mail. And hopefully they have responded to those notices, paid attention to them, because it gives them really good, clear instructions on what they need to do. There's also a website, in.gov/pathways, that has all of the forms, documents, a lot of FAQs on there about what's coming and what's going to be changing with that shift in July.
What do you feel is the big emphasis behind this? Because I can hear little voices saying, why are we changing, and I don't like change, and this has been just fine, and what are they doing?
Change is very hard. Uncertainty is very hard for individuals, and that's kind of what this is, something new that the state's embracing. Indiana, unfortunately, has not always ranked the highest with our care of older adults, and so the state viewed this as an opportunity to try to provide more encompassing care to help improve the care of the older adults.
And I've been seeing, again, to your point, and Abby as well, that the research contributing to this, 75% or more of older adults want to age at home and in their communities. This is a sea change, as they say. It seems, from the idea of, I'll go to a nursing home, I'll go to a senior care facility. Those are fine.
Absolutely.
But nevertheless, there is now this option that I guess has perhaps been always there, but maybe not as possible until now.
Yeah, no, absolutely, yeah. Individuals, want to remain in their communities. They want to remain within their supports, and aging and in-home services really allows individuals to do that through the different support networks that have been established, the partnerships that we've had, and the community that we've been able to establish. Absolutely.
There are letters, as Lori mentioned. Here's one, and it actually suggests if you are happy with your assigned Medicaid health plan, you do not have to do anything, which is my favorite thing to do.
Correct.
It doesn't happen very often. You may continue to use your existing Medicaid card during the transition. So it seems that also these individual companies are now going to be doing their own communications.
Yes.
To be sure that everyone understands what's really necessary and if I have to take action on my own.
Yes, that's the plan. The letters, like I said, I think they are very good and descriptive of what you needed to do, or if you didn't need to do anything, you could just be auto-enrolled into a plan, which you could switch later if you wanted to. But then the different health insurance companies will be following up with all of their members, providing them with all of the documentation, information that they need, the resources of who they can contact, and how to proceed with their new plan.
Okay. And if you have a question, you can call Abby.
Absolutely. Just
right.
call us.
Just call and see where things go. Related to this, there is a care transitions program.
Yes.
We have a little time to talk of this, but it seems that it's to help get somebody back in the home they want to be in.
Yeah, absolutely. So if an individual is at a nursing facility, they can give us a call if they believe that they're ready to go home, and they feel like they're able to safely go home. They can give us a call, and we can help assist with getting services into the home so that they can transition back to the community as safely as possible. There's several different options. There's care transition funds that can help individuals if they've been in a nursing home for a very, very long time, come back into the community and, get some of those staples back into the household for them. As well as other, Meals on Wheels, maybe if an individual needs a personal emergency response system so that if they're a fall risk, we can help, ensure that they're connected to a resource there. So absolutely.
And in all cases, all programs, all that you've heard tonight, no cost.
Correct.
Or for the, this is the, correct me if I'm wrong, but
we do have some private pay services if you would choose to, maybe if you didn't meet qualifications for something, you could privately pay for them if you wish. But otherwise, the services are generally covered through your insurance, like your Medicaid, or through your qualifications based off your income.
The Older Americans Act as well.
Right.
Okay, so there's no reason not to be in touch with Aging and In-Home Services, and here is how you can get in touch. You can, of course, go to your favorite search engine, and you see it agingihs.org or 745-1200, And if you hear a voice that sounds familiar, it's Abby's. And if she's not answering, it'll be, well, no. We want to thank you both very much.
Yes, thank you so much.
Thank you for having
Yes.
us. The Older Americans Act this month, this is a great thing to celebrate. I say we are very committed to this community and all the services we can provide. So as
Yeah.
Abby said, just call us.
Just call us.
And happy anniversary to
Yes.
Aging
Yes.
and In-Home
Yay.
Services of
Yes.
Northeast Indiana, where Lori Bones is Vice President of Population Health, Abbey Graves, Aging and Disability Resource Center Director. I'm Bruce Haines. For all of us with PrimeTime, thanks for watching. We'll see you next week. Good night.